Um, I know there's a lot of clamor for when is it my turn to get the vaccine. Right now, as of this morning, we've updated our section on vaccine prioritization to be able to provide greater clarity as to when that might happen. What we're seeing is that what we've done is we've taken the guidance from the CDC and from the Maryland Department of Health. Maryland Department of Health last week added some details to the prioritization, and so we've updated that and provided some rough months as to when we expect to move through the different phases. This is, of course, entirely dependent upon vaccine supply. If we don't see the supply we anticipate, it will take longer, unfortunately. But right now, what we're doing in December and January, we're looking at healthcare workers, public health, nursing home, first responders, judiciary and corrections, and those are well underway. One of the things we've seen with healthcare workers is that there's a slower uptake. So last week, we had invitations to over 15,000 individuals through their practices for 5,000 slots, and we'd only seen 3,000 signups. And so we put out to another 10,000 providers through their practices invites, and we're seeing some better uptake. But that just gives you a sense of how many people we have to send out an invitation to get those signups in place. And whether that's scheduling, those times people just can't schedule that same week, or whether there's hesitancy, we're working to understand that. But that's one of the challenges that we're confronting. We're anticipating moving into phase 1B in February and working through February and March. And that looks like congregate settings, so assisted living facilities, group homes, homeless shelters, education. And we've had conversations with AACPS about the teachers and staff there, and education includes daycare and the private schools as well, and adults age 75 and over. And lastly, in that group, continuity of government. And then phase 1C is April is when we expect to be doing the bulk of that. And that's the frontline essential workers. So people who have been working throughout the pandemic, don't have as many protections in terms of being able to remote work or had time off. So food and agriculture, postal service, manufacturing, grocery store, public transit, and then adults age 65 to 74. The phase 2 group includes a whole list of essential workers and then adults age 16 to 64 with high-risk conditions. And that's probably the question we're getting the most about, is the high-risk conditions. I have diabetes, I have heart disease. That's when we anticipate that group will be able to go next. I know that's not what people want to hear. I know that that's challenging. Our goal is to try to do this as equitably as possible and follow the framework that the CDC and the Maryland Department of Health put out. So that's why we're adhering to that. I think I'm going to end there. I'm happy to take any questions afterwards, but I'll turn it back over to you, Chris.
Thanks, Dr. Lash, and County Executive Pittman, you're up.
Thanks, Chris. Well, first, I just want to thank all of you in the press for participating in these every week. We've been talking about how best to get information out, how best to keep the public informed, what's the best rhythm for all of that. And these calls have been great weekly. And so we've decided that starting next week, we're actually going to live stream them as well so that the public can hear everything we're saying. So as you think about your questions, just be aware that it's going to be a little bit more like a press conference as opposed to a press availability. We'll continue to do these weekly reports, take all the questions, and try to keep the public informed as well as all of you. The governor's announcement yesterday of $1 billion proposed in legislation for COVID relief, economic, is welcome, and I was pleased to see that the targeting was done better than some of the past relief packages, particularly to the lowest income workers in our state. earned income tax credit package is particularly well targeted to the people who need it the most, I believe. Waiving income tax on unemployment insurance is also going to be welcome and useful, I think. And some of the small business assistance as well is going to be great. I'm going to be talking, I have been talking to our delegation, and obviously this goes through a legislative process. And this is exactly what our delegates to the General Assembly have been talking about doing for quite some time. So I think they're pleased that the conversation can begin and move forward on that. But just keep in mind that we do have our elected representatives to the General Assembly who have been working on this and will, I hope, have good communication with the governor's office to make sure that this package is targeted well and gets out quickly. On the assistance front, we are going to be reopening our portal through workforce development for direct humanitarian assistance, the $500 debit cards, particularly targeted to restaurant workers. We're going to be doing a lot of outreach there, but it's also going to be open to others who have lost work more recently, as opposed to in the first round that was from the beginning of the pandemic, who have lost income or work. So that's opening at aawdc.org/support, and people can sign up to qualify for those $500 debit cards. I also want to say that the logistical work on keeping up with the volume of vaccinations that we get is it's a huge undertaking by the health department, and it's actually a huge undertaking by all of county government. And we're lucky that I think I met with a number of our health and human service agencies last week in our regular monthly meetings, and kept hearing from a number of them how rewarding it is that the agencies talk to each other constantly to implement programs. And the fire in Glen Burnie was an example of that, where a number of families had to be relocated quickly. The work of the fire department helping with the vaccines that came to the health department for first responders is another example of that. And so you're going to see all county agencies pitching in on this vaccination effort, people's jobs changing, moving people around. Clearly, when we get our schools reopened, our school health staff is going to be going back to our schools. They're currently working in the health department doing other things related to the pandemic. So we're going to be moving people around as well as doing some hiring. And this is the number one priority of county government in the coming months, is to get everybody vaccinated against COVID. So thanking everybody in advance for that as well. And then I guess on another note, looking forward to the General Assembly, I think I've made very clear that I believe that the folks who got hurt the most by this pandemic are the lowest wage folks, and that at the high end of the economic scale, many have done quite well. And last year, I pushed pretty hard for the authority at the local level to be able to make our income taxes progressive. It used to be that way in Maryland when they were piggybacked on the state rates, but now they're flat rate regardless of your income. We introduced a bill last year that passed the House, didn't pass the Senate because they closed early. This year, MACO yesterday voted to support the bill. The Maryland Association of Counties gives counties the autonomy to do this. That was a big step forward to getting this passed. So that could take effect this year and be reflected in our upcoming budget. We'll have the authority to have brackets for different income levels on our income tax. So I believe that's everything that I have. Pass back to you, Chris.
Great. Thank you, Mr. County Executive. It's your favorite time now, time for questions. So if media want to unmute themselves and ask a question, or feel free to raise your hand or put something in the chat. Thanks.
Hey, this is Olivia from the Capitol. Mr. County Executive, forgive me, but did you say how many people you are thinking of hiring for the vaccine effort, or do you have a range of positions?
I'm gonna let Nilesh answer that because I know it's a moving target as school health staff move.
Yeah, we've been we're looking at needing about 120 people. So we right now have been pulling that from school health and from other parts of our department, from our disease prevention and management bureaus predominantly. But when school goes back in, we will not be able to use any of those school health staff. So we're going to have to hire, like I said, about 120 people.
Thank you.
Hi, this is Danielle from the Capitol. I am wondering, do you know, Dr. Kalyana Raman, similar to the way that you mentioned the percentage of healthcare workers that have been vaccinated, do you know what the percentage of first responders, police, fire have been vaccinated?
I don't know that percent, but that's one of the things we want to know. We're actually also going to be looking to see what percentage of hospital workers were vaccinated as well, and that'll give us a sense of what the uptake rate is.
Do you have any sense of why the uptake rate is so low for healthcare workers?
I don't know that it's lower than the general population. I hear your question though. Why isn't it higher than the general population? But in kind of general surveys, we've seen about 50 to 60% of people say they're ready, and about 20 to 30 say that they're going to wait and see what happens with this rollout. And so we're really still just in the early days of this. It's very early on in this process. We've only done about 2% of folks in the county have gotten the first dose, and so I think it's going to take a bit of time for people to get familiar with this and know people who've gotten the vaccine and get comfortable with it.
Understood. And last thing, real quick, I think we spoke last week about you were anticipating some data from CVS and Walgreens as to their efforts at the long-term care facilities in the county. Do you have a sense of how that's progressing? Did you get that data, and will you be releasing it publicly?
Yeah, I don't have that data specifically for them. We're able to pull how many residents were vaccinated, and so we're still working through those data issues because we don't distribute those vaccines. Those are distributed at the federal and state level. So still working on that.
Hi, Doctor. Hi, Doctor.
Hello.
Are you as concerned about the number of beds available as you were before Christmas in hospitals and stuff?
We're definitely just as concerned, if not more concerned. We're seeing the hospitalizations tick up, not just in our county, but in the state as well. We're seeing our case rates go up. We know that is a leading indicator. In our conversations with the hospitals yesterday, who are watching that very closely because they have to adjust their staffing and their capacity levels for that. And so we've talked about the fact that our projections show a peak in late January, early February. And those are just projections, right? So we have to be able to recognize if there's some different trends leading into that. We have to be able to respond to that. So right now we are waiting and seeing with them how this will unfold.
Are you satisfied with the number of vaccines that have been supplied so far?
This is the vaccine supply that's being made available by the federal government. So I can't speak to what that distribution looks like. Just we're getting at this point we're slated to get 5,000 this week again, and our goal is to get them all out the door.
Are you have any concerns about the upcoming Biden administration? I think their plan was to use all the first doses and not use any second doses. Is that correct? Or
I've read those reports, but I haven't actually seen anything in terms of like what that looks like as a plan or what the plan is beyond that. So I just I don't have a real comment on that at this point until I see some details.
What happens in a pandemic like after this surge? I know we've looked. There doesn't appear to be any great gathering holidays coming up. Is it going to level off? Do you hope?
There's two trends. One is as we have more vaccines, we'll be putting them out, and that'll help decrease the number of people who are getting sick. And then the second is as we get into warmer weather, that'll also help as it gets cold and flu season winds down as we get to warmer weather, and two, people will have the ability to go outside more and space our out, which also will help. So we have a few trends that are coming up, but it's going to take us a couple of months to get there.
Do you have any thoughts on the new variants of the COVID? Any concerns about that?
Yeah, we're tracking you're talking about the B.1.1.7 variant, which is able to transmit more easily, likely due to higher viral loads. Seem to be more deadly, but because it moves faster, more people are getting infected, and that affects hospitalization rates as well. So the state is submitting some number of samples to the CDC for genetic analysis, and that surveillance is happening across the country. To date, there hasn't been a reported case of B.1.1.7 in Maryland, but there has been one in Pennsylvania, neighboring state, of course. And so we're watching, because once that starts to show up, when it's shown up in other countries, it starts to rapidly become the variant that is dominant because of how quickly it moves. So
are variants normal in a disease like this? Do they occur naturally, normally?
Yep, variants have been happening throughout this pandemic. This is noteworthy because of how quickly it transmits, but there are other variants that have been identified for the COVID virus.
Matt, I want to give other folks a chance.
Okay, sorry.
Jump in, sure.
Joseph Ojo, Fox 45 News for you, Mr. Pittman. Just with the planned protests that are set to be going around the whole country, are there any concerns in other parts of Annapolis? Will there be any special steps to protect the area?
Certainly our concerns and monitoring, and our police department has been in touch with the federal authorities. They don't have planned events that they know are scheduled, other than the general threat that all 50 capitals, but they're monitoring, and we're our police department, Annapolis Police Department, and the state police are all going to have enhanced security during that time in the Capitol.
And just any update on the officer that was caught at the Capitol? Do you know anything on that?
No updates there.
Yeah.
Other questions?
How are the medical staff doing? Are they getting stressed out? I mean, obviously they're stressed, but is it a cumulative effect on medical staff with coronavirus?
Yeah, we've been, I won't speak specifically for them in the hospital, but I know that generally medical staff and hospital staff generally are feeling the brunt of responding to this pandemic for over 10 months now. It's definitely, as we get into even higher volumes, it just puts more stress on them.
Rick Hutzel from the Capitol, real quick. Dr. Kelly-Roneman, a couple weeks ago, you tweeted out the congratulations to Vivek Murthy, the Surgeon General appointee by the Biden administration. Do you know the Surgeon General appointee? Is that the title?
Yeah, a little bit. We worked together many years ago.
So there wasn't anything beyond just congratulations to somebody I knew. You're not angling for a job with
no. No, it was a benign tweet.
You better not be.
Thanks very much.
Great. Well, thanks a lot, everybody. Appreciate it. And we'll see you next week. And remember, we'll be live streaming. So be on your best behavior.